Hello everyone, I am Dr. Nampoothiri. I am a senior gynecologist at Apollo Navi, Mumbai. Today I'd like to speak to you a little bit of things about obesity. What is obesity? Obesity is when your body fat is much more than the required one. We all have a little bit of fat in our body, there is no doubt about it. But when it becomes more, it is called obesity. And how do you measure obesity? It is quite difficult to measure obesity. We have made a few formulas like a body mass index. Even though it is not very accurate, we can use it as a rough measurement for obesity. So body mass index is your weight in kilogram divided by your length in meter square. So this varies. The normal values vary along with your sex, with your ethnicity, with your age, and all. So WHO has said that Indians should have a BMI of only up till 23. 23 and above is 23 to 25 is overweight, and above 25 is obese. But by old standards, we always call ourselves normal till up till 25 BMI. But please note the difference between the WHO value now, which has brought it down to 23 for Indians, because Indians are used to this famine gene. We are used to a life of famine. Even little bit is too much for us. And now with the influx of a variety of foodstuff and our lifestyle undergoing a change, you know how the weight changes in everybody. What are the types of obesity? We have two types of obesity. One is called the apple obesity and the other is called the pear-shaped obesity. Apple-shaped obesity is when your tummy starts increasing, and pear-shaped obesity is when your buttocks start increasing, when the lower half of your body. So the apple-shaped obesity is supposed to be worse than the pear-shaped obesity. Both are bad, no doubt. What happens if a person is obese? Let us go through it stage by stage, that is by the age group. Now, in young children, in school, obesity is a big, let us say, an epidemic now, because more than half the children in the schools, especially in the urban areas, are obese. Their BMI is different from the BMI of adults. And as you can see, the heavy weight, when the weight increases, there's more chance of developing diabetes and all that. And when you come to adolescent, especially in girls, what happens when your weight increases? Your periods go for a toss, and these girls go into something called a polycystic ovarian syndrome, where one of the biggest factor is weight gain. They also end up with having lot of acne, lot of hirsutism, that is hair on the face, etc., along with irregular periods. And the moment you start exercising and your weight comes down, we can see miraculous changes in the periods. It becomes better and better till it becomes normal. And let me tell you, guys, key, even in a case of polycystic ovarian syndrome, any amount of medications that are offered, the final solution that comes is with exercise only. Now, when this girl grows a little bit older, in the reproductive age group, what happens? Many of them come to us with fertility problems. They are not able to conceive. So we tell them, you reduce 5% of your body weight and your fertility becomes double of what it is now. And when they do conceive, maybe naturally or with help from doctors, what happens? You are more predisposed to diabetes, more predisposed to severe hypertension in pregnancy and all that. Your baby becomes a big baby. When you are big, your baby also tends to be big. And that causes difficulty in delivery, and you end up having a cesarean. And what happens to the baby who's inside the womb? The baby also tends to be big. When the mother is big, the baby also tends to be big. When the mother has diabetes, the baby tends to be big. And these babies in turn become diabetic later on in their life. They become obese too. So it's a vicious cycle. We have to catch it young, in utero, as we say. Diabetes is, a lot of it is genetic as well as environment. So the genetic things we cannot modify. A lot of Indians are diabetic, but at least the environment we can try to modify. So bringing down the weight goes a big, big way in controlling diabetes. Now that reproductive age group is gone, you come to the perimenopause age group, maybe 40 to 45 and above. What happens when your weight is increased? A lot of mechanical difficulties, no? There are a lot of difficulties in the movement. You are more predisposed to arthritis and all that. And you are more predisposed to diabetes, which is early onset if you have increased weight. Now, apart from all this, now we find that many of our cancers are also lifestyle diseases. Cancers like cancers of the breast, the endometrium, that is the inside the uterus, and some of the ovarian cancers are also very much related to the weight of the person. There is something like called corpus cancer syndrome, where people are hypertensive, diabetic, and they have a carcinoma of the endometrium. As you grow older also, look, when you become older, you want to be independent, isn't it? You want to move around yourself without any help from others, so that you can do things on your own. So when you are obese, you find all this very difficult. So in short, you have to keep your weight under control, and this should start quite early. Mothers, the parents should be very careful. See, obesity runs in the family because nobody runs in the family. The parents have to have to set the example of weight loss, and then the children will follow. However much you tell your child you have to lose weight, they are not going to do it unless they see somebody do it. And it is not possible to restrict the food of adolescents and the young children. You need to lose weight by working out, not by starving yourself. Of course, diet does go a lot in the way of in for weight loss, but exercise also does a lot. So I will conclude by saying that all of you should become very active, take part in a lot of sports, dance or running or swimming or whatever it is that interests you, along with a diet control. And please try to keep your weight under control. This will go a long, long way in your life. Thank you.